Hello, and welcome to the Canadian Science Policy Conference. My name is Naomi Schumann, and I'm chair of the program committee and a senior volunteer with the Canadian Science Policy Centre. I'm joined here today with Cate Murray for part of the CSPC interview series. Cate is president and CEO of the Stem Cell Network.
Thanks for having me.
Thank you for joining me. The existence of stem cells was first confirmed by two Canadians, but most people aren't necessarily familiar with the potential of stem cells. Can you tell us about stem cells and their role in regenerative medicine? And where is the science heading?
Sure, thanks, Naomi. So stem cells, you're right, were first discovered. They were in the early 60s by James Till and Ernst McCulloch at the University of Toronto. And they are the building blocks of the human body. And today, they power the field of regenerative medicine. And what's really unique and terrific about stem cells is they can differentiate into any tissue or cell or organ in the body, or they can be self-renewing as well. So this is opening the door to all sorts of potential therapies. And it's not just treatments. It could be curative for a variety of chronic diseases. Type 1 diabetes, for instance, we are at the head of that science in stem cells and type 1 diabetes in this country. And I think we may see, before my days on this planet are over, a cure for type 1 diabetes that uses stem cells. Cancers, multiple sclerosis, muscular dystrophy, neurodegenerative diseases like Parkinson's and Alzheimer's. Stem cells offer hope in all of those areas, but not just for disease, but also for illnesses, sepsis, COVID-19, in fact, and for injury, for those who are burned or who have retinal degeneration. There's a lot of promise with stem cells. It's really going to disrupt how we care for people, and it's going to lead us and take us to a world where we can realize personalized medicines.
Great. You've led the Stem Cell Network for 5 years now. How is the network advancing the field of regenerative medicine?
Well, it doesn't feel like 5 years. It feels like about 5 minutes. Time goes quickly. So the Stem Cell Network has been a leader in supporting research and building Canada's community in stem cell research over the last 2 decades. We not only fund research, but we train next generation scientists, and we also work in knowledge mobilization to ensure that the science and the information continues to circulate and grow. We did a survey a couple of years back with 150 stem cell researchers from 12 different countries. The vast majority said that they see Canada's contribution to stem cell research as highly significant, and they marked Canada as third in the world for its contribution behind the United States and Japan. The Stem Cell Network has been building that community. We're the on-the-ground community for researchers, by researchers. We don't just fund and forget. We grow collaborations, we support our teams, and we make sure that our projects move from the bench to the bedside.
What do you believe is the most significant challenge facing regenerative medicine in the future?
Great question. So for me, it's about getting these therapies to patients. We really need to start to unpack issues around access and affordability. The science is going to come. The question is our healthcare system going to be ready to adopt these medications, to adopt these therapies? Are our regulators going to be able to effectively and efficiently bring them into the system and ensure their safety and efficacy along the way? It's very complicated. And we also need to think around the costs. Today, our healthcare system is designed to pick the lowest cost drug on the market. This is going to change because when we bring in regenerative medicine therapies, you're going to need that therapy once, not multiple times. So the cost is likely going to be higher on the front end, but it's going to save the healthcare system and our society and tax dollars along a significant money along the way.
That's very interesting. So I know that with COVID-19, we saw a lot of misinformation. How has COVID-19 changed the way that you deliver trusted information about regenerative medicine?
So before we knew about COVID-19 and we were dealing with all of the misinformation, our field was already tackling misinformation with stem cell research and with potential false stem cell therapies, to be more precise. This is a global issue. And in the stem cell network, we have a really robust community of policy experts, of experts who are science communicators, who are looking seriously at this issue of misinformation. And in fact, it was their research and evidence that pushed our regulators to shut down clinics that are offering what essentially is snake oil and offering therapies to people that are actually going to put them at risk and make their wallets a little bit lighter.
Great. So it's clear that Canada is a leader in this field. What do you think Canada needs to do to stay a leader in this field?
This isn't just about money, and I suspect that was probably the answer you thought I would give. It's much more complex. You've heard me mention the regulatory environment. We need a nimble, flexible regulatory environment that's going to be able to process these therapies as they come through. We need an immigration system that's nimble and going to allow us to attract and retain talent here in Canada. What's happening, and what I hear from the researchers in our community, is they can't get the visas to bring in the specialists they need to work in their labs or in their companies. And by the time those visas come through, those people have been recruited somewhere else. That's a competitive loss for us. So if we want to stay at the cutting edge, if we want to stay competitive, we need an immigration system that's responsive to. We also need an investment environment where taking risk is okay. So our Canadian investors, they want to invest in Canadian therapies, but there's challenges for them on the risk side. And they typically wait until others have come in. So de-risking is a really important issue. And that's where an organization like ours also comes in, because we can de-risk through clinical trials research so that investors have the data packages they need so that they can come in. So we really need to understand the investment environment so we can bring these things through. Ultimately, at the end of the day, we need to be competitive, and that means keeping pace with the OECD countries and other research-intensive countries. And what that means is how we think about research needs to shift. It is not an extraction on our economy, it's an investment for our economy. So if we can change our mindset, things will come in time, the therapies will come, the treatments will come, we will continue to see greater advances, and Canada will continue to lead the world.
Wow. It seems the stem cell network contributes a lot to this field and to the field of science. I want to ask you about your engagement with CSPC. You've been involved for a number of years and a big supporter of CSPC. What do you see as the biggest value and benefit for participating and attending CSPC?
I remember when Meridad first launched CSPC. I was at that conference many years ago in Toronto. and maybe I'm now dating myself. And I was excited to be able to attend then. And I was excited because this brought together not just those in the life sciences, but those who are in the social sciences and the natural sciences and engineering. And it's such a unique opportunity. There is no other conference like this in Canada that brings together all of the different scientific fields into one room. So the conversations are really deep and enriching, and it provides opportunities for us to then collaborate in different ways we may not have thought about before. And it gives us the opportunity to put out the common challenges that we see. And I think at the end of the day, we all come away a bit more energized, knowing there are others who are facing the same things as us. CSPC, it's a rallying point for Canada and for our science community. It offers tremendous value.
Thank you for that. And thank you for participating in the CSPC 2022 interview series. We appreciate your support and involvement, and we hope our viewers will check out some of the other interviews. Thank you.
My pleasure. Thank you.